Hi there. A quick review or overview, you can say, of placental physiology. So let's start the talk. So basically, what is placenta? It's an apposition and fusion of the fetal membrane with the uterine mucosa for the purpose of exchange of nutrient, gases, and waste substances. So basically, it performs three functions, and you guys already know it. So let's talk about a little bit about structure, and then we'll go with the physiology. So structure-wise, as you can see with time, the diameter of the placenta increases, the weight increases, and the thickness increases, and of course the length of cord. So pause the slide and look at it. Most of our premature babies are going to be delivered in, let me just show you this one, in this section. So a 23-weeker. So look at the placenta and look at the weight of the placenta and thickness and the cord length. So the stages, as you see in this slide, that by basically by 21 days, the placenta is really functioning fine. It has syncytoblast and the exchange is happening. So this is the slide which shows the maternal side and the fetal side. This is another one, same thing. So now basically, the placenta is divided into feto-maternal unit. We call it cotyledon or placenton. So usually there are 15 to 20, and each cotyledon is functioning individually, as shown in the picture. So what are the types? Structurally, your normal placenta, which is placed usually posteriorly. Otherwise, you can have placenta previa, which could be either partial or total. What are the types in terms of functional? So in mammals, we have epitheliochorial, then endothelial, and just remember human and rodent have hemochorial. So basically everything is mixed as compared to the other mammals. So how much blood goes through? So almost 1/5 of the cardiac output of the mother goes through the placenta. So just remember that. And this slide shows how the diffusion happens. So what are the functions of placenta? Of course, fetus is not doing anything. So placenta is basically taking care of all the functions. So gas exchange, nutrient supply, excretion, hormones, and of course a barrier with the amniotic fluid and the other things. So this is another slide showing the hormones during the which placenta secretes and control. And if you want to know how it regulates, look at this picture. It's a very complicated system, and nature has designed it in a fantastic way to make sure that the fetus gets what it needs to and grows well. So how is the things transfuse or transfer through the placenta? So it can go through diffusion. Glucose can go radially. It can have hydrophilic permeability. There is carrier method with energy dependent or non-energy dependent. Then of course flow limited, just like oxygen, and by endocytosis, just like immunoglobulin G. So basic. And what about drugs? So basically drug follows the rule of this equation explains it all, that except for the membrane thickness, everything is directly proportional. So if a drug has a more diffusion constant, it diffuses fast. Higher concentration makes sense, area of exchange. But if membrane is thick, which makes sense, it's inversely proportional. So any placenta which has pathologies or is thick, the transfer of drug is delayed. Or okay. So what about the other factors? So this is another important slide. Lipid solubility is really important. The drug which are lipid soluble diffuses fast. The drug which are ionized usually are polar, and they diffuses slowly as compared to non-ionized drug. Protein binding makes sense. If a drug is protein bound, it will diffuses slowly, and of course higher molecular weight diffuses slowly. So only thing to remember from this slide is ionization. A drug that is ionized is going to cross slowly through the placenta as compared to the non-ionized drug. So again, some of the tips, what does cross the placenta. So again, remember, insulin does not cross placenta. So in babies born to infant of diabetic mother, is the drug that causes more harm than insulin. But we kind of have this concept, though mom is insulin dependent. Basic idea is that mom is insulin dependent, so it means that mom is sick. Insulin does not cross placenta. And also same thing with heparin and IgM and some hormones. So what crosses placenta through active transport, the amino acids, vitamin B12, iron, calcium, dexamethasone, and some water soluble vitamins. This is basically for fellows. This is asked in exam that they have to remember which drug crosses the placenta faster and get the level on the fetus faster than the maternal level. It's important in terms of certain drugs. For example, most of the antibiotics, after you give it to the mother, the concentration is more on the fetal side, and rest are different models. So basically, in anesthesia, thiopentol really go faster as compared to the other muscle relaxants. This is important to remember because if a baby is being born and mom is already on MAG and mom is receiving general anesthesia, probably this baby is going to have a depression at birth because these drugs have crossed the placenta. So in summary, the definition of placenta is a membrane which is between fetus and mother. We talk about structure, development, and circulation. We talk about the function. It's a multifunctional organ. And remember what crosses the placenta, especially the drugs. So let's conclude our presentation. So let's do this question together. So regarding the placenta transport, all statements are correct except. In exam, these except questions are not coming anymore, I hope, but the idea is to have the concept. So molecular weight of greater than 1000 limit transport. That makes sense. Higher the molecule is difficult to go across the placenta. Lipid solubility enhances diffusion. Absolutely. Ionized drug diffuses rapidly. It should be other way around. Non-ionized drug diffuses rapidly, because when it's ionized, it's become polar and it's difficult to transport through the placenta. Higher protein bounding decreases transport. Yes, that's true. If it's highly protein bound, it's difficult to transport across the placenta. And decreased blood flow limits transport. Absolutely right. If the blood flow is going fast, the transport is faster. So that's I think that's it. And these are my references. So I hope this small brief presentation just give you some guideline on placental physiology, especially in terms of what go across and what stays at the fetal side. Okay, have a good day. Bye.